Data reveals surgeon burnout is reaching critical levels, with more than 50% of surgeons reporting frequent burnout. Board-certified thoracic surgeon Dr. Africa Wallace joins us now with more. Thank you so much for joining us. And what does this behind the mask survey reveal about the scale of burnout among surgeons?
Thank you for having me, Jordan. And I think this is an important conversation that we're having today. You know, the Behind the Mask survey really gives a clear picture of the experiences that surgeons have today. We surveyed more than 1,500 surgeons across 5 countries, and quite frankly, I wasn't surprised to see that more than half of those surgeons said that they were suffering from burnout symptoms some of the time. You know, and that's not meant to be a headline. It's not meant to be alarmist, but I think it's a signal that we should take seriously.
Right. I mean, such an important job. We want to make sure that they're doing what they can for their self-care and making sure that they're taken care of so that they can take care of us. So how does this crisis impact healthcare overall?
Yeah, so it impacts healthcare in a very practical way. It impacts capacity and it impacts access. So, you know, 40% of the surgeons said that they even thought about stepping away from surgery at some time, and these were those that had frequent burnout. And when you lose a surgeon, what happens, what the patient feels is that there are longer wait times, there could be lack of access to specialized care, and it also impacts the care teams. So replacing a surgeon is not easy, it doesn't happen quickly, and it can cost a lot.
I'm sure.
So I think it's important that we support surgeons so that we can preserve the access.
So important. And your research shows surgeons feel burnout for different reasons. So what are some of the biggest pressures that they're facing today?
Yeah, one of the clearest things that we saw was that it's not one thing, it's a combination of things. So first there's the clinical intensity, patients are sicker, the cases are more complex, and managing the patient journey the entire time is emotionally tasking. There's also personal sacrifice, there are long hours, unpredictable schedule, and that makes it hard to recover and even connect at home. More than half said that they felt guilt because they don't spend enough time with their loved ones. And then lastly, there is the administrative load. There is a host of non-clinical tasks that surgeons are responsible for, and that takes away from actually taking care of patients.
Right. So what solutions do surgeons say could make the biggest difference?
The solutions are simple. They're not asking for anything complex. You know, they would like to have relief for the administrative burden that they have, and perhaps there are technologies like AI that can help reduce some of that burden. They want more connection with their peers. Surgery is a very culturally, it's a silent culture, and there could be feelings of isolation, and they noted that a simple conversation with their peers could be helpful. And then lastly, they would love for us to have systems and processes set up that could recognize burnout earlier, perhaps preventing it, and or when they're experiencing it, there are resources that can support them. So it's really less administrative work, better connection, and better recognition.
Well, where can we go for more information on all of this?
Yeah, if you're interested in learning more about this, please go to thenext.jnjmedtech.com/behind-the-mask.
Well, thank you so much for joining me today, and I hope that they can get some of the relief that they definitely deserve.
I absolutely hope so too. This is an important topic.
Very, very. So thank you again, and everyone at home, if you would like to see this interview again, just head to First Coast News Plus.